Now I'm going to do number 4. And number 4 says a patient weighs 20 kilograms. An order has been written for ceftriaxone 50 milligrams per kilo per day. The drug is given every 12 hours. What is the total milligram patient should receive in each dose? Again, it's in each dose. And I'm asking you again, how many milligrams are you going to give in each dose? So you have 50 milligrams that you are going to be that you have in your hand, and it is per 1 kilo. But what does our patient weigh? Our patient weighs 20 kilos. So you have to do 20 kilo, and you're supposed to give it over 24-hour period, because you're supposed to give 50 milligrams per day, but you're supposed to divide it into 12 hours over dose. So the answer is 500 milligrams per dose. So if you calculate it, it comes to 500 milligrams per dose. So you have to write per dose in your exam, because if you don't, I will take points off. That's number 4. So now we're coming to number 5. Number 5 says a patient is to receive 100 milligram glucosate sodium, which is by the way called as PO. The patient has trouble swallowing, so the nurse asks for oral liquid form. You have to give him oral. This is a child who cannot swallow pills. The drug comes at 150 milligrams per 15 mils. How many mil should the nurse administer? So now I'm asking you mils, and you have 15 mils at hand over 150 milligrams. You know you should follow what I'm doing here and what I'm ending up here. So here's 15 mils, and then we are supposed to give 100 milligrams, correct, over dose. So the total is, if you look at it, it's 1500 over 110, which comes to 10 mil. You can write per dose or 1 dose. All right. Colic should only be given once a day. It's a stool softener. So now we are going to come to the actual IV problems. Now I am going to give you IV problems because I have seen in your NCLEX that you get IV problems. But I'm going to show you briefly in your exam, math exam with me, the actual exam test, pre-math test that we're going to do. I will not give you an IV problem, but I want you to get familiarized with these IV problems. So I'm asking, an order is written for 100 mils over 24 hours lactate ringers, which is LR, IV. The drip factor or the IV setup is 60 GTT per mil. The drip factor is actually your tube. GTT 60 is always going to be micro, and 10, 15 is macro tubing. So they get more quickly with 10 and 15 and slowly with 60 GTT drip factor or tube. The nurse should set the drip rate at, so how much will you give per minute is what this is asking. So GTT and drop factor is one and the same thing. I'm going to write GTT. And we have 60 GTT, as you can see, over 1 mil. See, we're going to end up with GTT. We need to end up per minute how much we're going to give. And we have 100 mils. And you're supposed to give that 100 mils in 24-hour period. But you have, how many minutes do we have to an hour? You do 1 hour over 60 minutes. Because in 1 hour, there's 60 minutes. You have to know GTT per minute. So the hour and the hour cancels here. Do you see that? And the mil cancels. So there's GTT and minute left. So the answer here is 41.6. It's 66666, but I'm going to do 67 GTT per minute. And this is your answer. It is not difficult to do an IV drop. If they're asking per drop, always put the drop first here and 1 mil. And then you have 100 mils that you're going to give over 24-hour period. In 1 hour, we have 60 minutes, and it's 41.667 GTT. It's 666, but we're going to do 67 here per minute for argument's sake. So I'm going to do number 7 as well. Let me do the same with 7. It's also an IV problem. An order is written for ampicillin 500 milligrams. Please know the medication ampicillin because you will see it in your exam as well. Ampicillin is given when you have certain issues. So especially if a mother is GBS positive, they give them the medication called ampicillin before she gives birth. Otherwise, if you don't give it, the baby can be born blind. So ampicillin is an antibiotic that you need to remember and know what it is all about. So we are supposed to give ampicillin 500 milligram that is already been dissolved in 200 mils D5W, but it has to be run over 2 hours. The drip factor is 10 GTT. 10 GTT is macro, not micro tube factor. The nurse should set the drip factor again. The same thing we are asking is GTT, the drip factor. And we have 10 GTT here. And we have 1 mil. Am I correct? We are supposed to give 200 mils because 500 is already begin dissolved in it. 200 mils in our 2-hour periods. Remember, 2 hours. And we have 1 hour. And in 1 hour we have 60 minutes because we need to have per minute how much are you giving. So only thing is left is GTT per minute. Again, the answer here is 16.66666, but I'm going to do 16 GTT per minute.